morning and welcome, Dr. Ajaikumar. Welcome to the HCR podcast. Healthcare during COVID-19 pandemic has had a great impact on the healthcare system. How do you think COVID-19 has changed the global healthcare?
Now, one of the things about the COVID 19 is the first wave, second wave. Obviously, it's some kind of a pandemic like this, people are not prepared. One of the things we going forward will be really looking at is can we prepare for such pandemic better. As we see the last 2 years, when we reflect on it, one of the things is that people did not expect the severity of the problem. Even though we called it pandemic, a lot of people refuse to accept the fact that it could be such a major effect on the human race. And for this, obviously, we will remember it for a long time. The catastrophe which followed, where elderly people affected, where hospitalization, this is a global phenomenon, hospitalization, no beds, no availability of oxygen, ICU no beds not being there. I think it is once in a lifetime experience from all. A lot of people lost their dear loved ones, and that is a permanent loss, obviously. So I think with this pandemic, we hope we will be better geared in healthcare and better able to be proactive rather than reactive. And I think that is the key in my view. How do we manage and can we prevent such pandemic? Analyze how it happened and how can we prevent? B, even if it occurs, rather than becoming very hyper and looking at container lockdowns and all, is there other way we can manage this disease, which I think it could have been. Third, one of the good things which has happened because of pandemic, how we have accelerated the vaccination program. Even to make the vaccination, it would have taken years for us here. Today in the world, it took only months. That is a phenomenal turnaround. And this could be the future. The vaccination, how we did, or what we learned from this, can lead to problem solving on other diseases, including maybe cancer. So I think there is always, whenever such catastrophe happens, there is always a good side in terms of future research, and look at the way we do conferences, meetings, the metaverse. All of this may be positive for the environment as we go forward. So we have to look at it in a mixed way, but certainly the pandemic has given us a lot of lessons and food to chew on for a long time and think about it and see what is the learning curve here.
As you rightly said, the pandemic has changed a lot of systems and practices. So, in your opinion, what changes are needed in the hospital to tackle such emergencies? What's the main problem here?
I think the main problem is one of the things is how do we are prepared for emergency. For example, you take oxygen. Nobody thought we will have problem with oxygen. Not only in India, in globally. Nobody thought we will run out of ventilators. And, so we are now better prepared, people putting oxygen plants, oxygen concentrators. So I think this will definitely, in our own system, we know it will definitely make us more proactive and look at these things, possible things, and be prepared for it. Second thing is, I think the emphasis we are going to play on hygiene. One of the things we have seen in our hospital setting, once this COVID-19 hit all of us, doctors, nurses, even patients are more hygiene conscious. Even simple things like washing their hands, wearing masks, and being well prepared, sterile conditions. I think this will be a positive effect because post-pandemic, obviously, we are going to continue to see some infections, regular viral infection, bacterial infections, but there may be less of it. In fact, we did a study in our SCG where we found during the pandemic era, there were much less bacterial infection, non-COVID bacteria, H1N1 infections. All of this indicated we were taking a lot more precautions, and this may become a sustainable model. even in future we'll continue to do that, which is very good for hospitals, patients, and number of hospitalizations for these kind of opportunistic infections may become less, which is very positive.
What are the best practices that India should embrace from the world to build a robust healthcare infrastructure in India?
It's a loaded question because I practiced in US for 25 years.
Okay.
Pretty much know what the advanced countries do for healthcare, even though there are limitations. But one of the most important things in India is I look upon India as two different countries within a country. You have 350 million population, middle class, upper middle class, higher class, moving up the ladder, demanding high quality of healthcare. But when you really look at this population, this is equal to United States or entire Europe. So it's a huge population, who are capable, who can afford and demand a high quality of care. Then there is 900 plus million, which are in the other strata, lower socioeconomic strata, who require a lot of help to bridge this gap. So the question comes up is, what is the role of private healthcare? By all accounts, private healthcare is taking care of 78% of the healthcare in this country. So what should be the role of private healthcare? Can we enhance the role of private healthcare to penetrate these, under-treated people in the rural, semi-rural area? Or is the government alone capable of doing? Or should there be a hybrid model? But based on the advanced country models, you look at Europe or US, one of the most important things, if the government wants to intervene, is a universal healthcare. For healthcare to be accessible, universal healthcare is important. What do I mean by universal healthcare? See, rich or poor, I put it in simple terms, they have to get the same care. Is it possible? Yes. Look at United States Medicare program, for example. Even though it is very expensive for the nation, United States spends almost 19% of the GDP on health. But as a Medicare recipient, you can go to any hospital, doesn't matter what your economic status is, and get the same treatment. And if you are an insured person, pretty much you can get the same treatment with no limits. That is the key here, no limits. See, if you have a system where there is universal healthcare, automatically the healthcare will change to a different level. Take, for example, in India today, in the private healthcare, we take care of all sections of the society. So when a patient is cash paying or a private insurance, honestly, we can do everything what is needed. And we have the infrastructure. And one of the major things in big cities, now even in some tier 2 cities, the infrastructure is equal to the West. Phenomenal. Whether it is cancer care, whether it is cardiac care, orthopedic, kidney, phenomenal infrastructure we have for these 350 million people. We are equal to or surpass a lot of advanced countries. Very few people talk about it, but we are there. For value-based medicine, which, of course, we know a lot of Harvard Business School have written studies on India, including SCG, how some of our centers have excelled in making sure people get the outcome equal to the best of centers in the world at a fraction of the cost. So we have done it. But what is the problem? The problem is the other 900,000 who cannot even afford even this fraction of a cost because the per capita income is low. For them, it looks very high. Imagine a patient who comes to ICU, gets admitted, phenomenal care, but the bill is 10 lakhs. So nobody can pay out of pocket. Very difficult for people. You are well-to-do, but imagine poor the socio-economic group coming and saying, I want a best of ICU care. Cannot. But look at the schemes. There are Ayushman schemes, other schemes. Will they pay for that? No, because they have limitations and they're very restrictive. What service they pay. So there is a conundrum here. There is a problem. And I think spending 1.5%, 2% of the GDP is not going to solve the problem. If you look at per family, what is the spend? $9,400 in US, $5,000 in Europe. India is spending something like $80. How in the world can you bridge this gap? So what is going to happen in future if we do not do anything is, as we know, the disparity between the have and have nots are increasing rapidly in India. India is one of the few countries, India and America, where there's a wide disparity. This disparity is going to even keep on increasing. And, as the 350 or 400 million will have access to phenomenal healthcare, this another 900 or so will be left behind. To bridge the gap will become more and more difficult. Because you take, for example, a PET scan or a CAT scan, look at the cost in India versus West. It is one-tenth the cost. We PET scan for $300, $3,000 in US, insurance paid. So there is, the cost-wise, it has been hammered. People, it's fashionable for people in the industry to come and say, oh, cost. Where is the cost? Today we are doing cardiac surgeries. The cost of cardiac surgery is the same at what was in the 1980s. Okay. Mm-hmm. So there's no cost here. PET scan we do at 20,000 means, for 15 years ago, 20,000. So there is no inflation adjustment, nothing. But it is going to be, this model, what we are on, it is not good. How can a country become advanced? Health and education. We have to bring uniformity of healthcare. And this is where I think, by some standards in India, even today, in the primary healthcare, we are below the sub-Saharan region. It is pathetic. Nobody wants to talk about it, but it is pathetic. We have to improve primary care first. And the government role should be to improve the primary care. Whatever it takes, we can partner with private, it can do whatever it wants. Look at the way we have vaccinated 1 crore 50, 1.5 crores, whatever we have vaccinated, phenomenal job for COVID. So when an emergency comes, we have geared up and done it. Why can't we do it otherwise also? Bring about this change in the primary care across India. And how to work with private healthcare. Government cannot do this infrastructure. It is not possible. I wouldn't say impossible. It's next to impossible. It has failed since independence. So it is time to say, hey, can somebody come and penetrate this secondary market, tertiary market, primary market, and create an infrastructure? Yes, it can be done. It's only the private healthcare which can do, and government can be a monitoring agency. In my view, the role of the government is to make sure whether it is BPO patient, BPL patient, whether it is affording patient, they get the right treatment. Today, that is not happening. That is the sad part of it. They are not getting equal treatment to those who are paying what is really the necessary payment. So this, and look at people like at CGV, we don't have any dividends. We don't give any dividends. What we do, we plow back the money, whatever, into getting better infrastructure, better technology, better talent. So the margin for us is not great. And whatever there is cash flow we get is used to plow back into the system to build better infrastructure, better talent. And that is how we are challenging the world in cancer care today, HCG is. But unfortunately, this does leave a gap in terms of those who are lower socioeconomic, who cannot afford, even though we have a cross-subsidy program, we have foundation, but there are limitations. For example, if you have immunotherapy, look at immunotherapy is a blockbuster. It can really treat a lot of advanced cancers, lung cancer, colon, provided they qualify for it. Cost is about 1,10,000 per each injection. And there is, how can you provide that kind? And no scheme provides that kind of benefit in the government schemes. So these are all anomalies. It requires a really thought-provoking discussion, an expert panel. But unfortunately, the government, in all its wisdom, somehow we have not seen this angle. And a government has to detach from the fact that it is government alone cannot do it. It's a failed proposal. They have to now think, how can we bring all the stakeholders together? How do we create a path for this to improve the infrastructure of the health and make all health accessible, equal to all sections of society, so that this is one step towards becoming an advanced country.
I totally agree with you, doctor. When it comes to the rural healthcare, we are a failed system. I agree on that, and I do believe that a public-private partnership can become a norm in the healthcare ecosystem that we saw during the COVID-19. So do you think it can become a norm in the Indian healthcare ecosystem?
No, it has to become. But one of the things I would like to say, Sujatha, is unfortunately, today we have bureaucrats in the system, not technocrats. If you look at the Indian system, who are the decision makers in healthcare? Bureaucrats. One day they are in the railway bureaucrat, tomorrow they're health bureau, and they are teaching us what is the best in healthcare. The system is fundamentally flawed because of this. So it is important that people who are experts in the field, who have ground zero level experience, who have seen what is rural, what is it the people in rural people want, what is it, look at it. From there onwards, if you build, understand, I think it is possible. Let me go back to the Indian system in the past. If you go to any small towns, whether it's Shivamogga, Angol, or Gulbarga. How did those cities manage healthcare in the past? Mom and pop nursing homes. There are a lot of people who went to the local doctor. They didn't even give money. Sometimes it was barter. They would tell the doctor, "Doctor, I got this grain which I grow. Please take it and take care of me." And the doctors took care. So there was a good symbiotic relationship. And this thrived. We could have helped that to grow. But today, what is happening, what is a danger zone for me is a lot of these small hospitals, nursing homes are on the verge of extinction. Why? Because A, the doctors are getting old. B, they don't have family heritage to continue because a lot of the children are out. They're becoming super specialists, moving out, software engineers, going abroad. So this is going to be a major problem in India as we move forward because there is literally no primary health care, very few, scattered. And the government situation, if you're given a choice, we did a survey of 1,000 people in Gundalpet area. Almost 90% say if there is a choice, they'll go to private healthcare. Okay. So all I can say is, it is how do you empower private healthcare? How do you do? Look at the whole COVID situation, even the budget which was presented. Not a single word about how do we take care of healthcare in India. Something about national health and all, mental health and all, okay. But not about how am I going to fund extra for healthcare? How am I going to, in US and all, Sujatha, where I know I still have a lot of connections, I still have a place. People gave subsidies to hospitals. I know a hospital administrator in Chicago who said they got $70 million as subsidy from US during the COVID so they can survive. Not a single rupee was given by the Indian government. Not a single rupee. But we all managed to survive. Not that we have to be critical, but all I'm saying is good intentions, but wrong path. We have to, if we have to change Indian healthcare, it requires a massive effort. It requires, like you said, solid PPP models, but PPP has to be defined in a different way. For me, universal healthcare and allowing the private players to penetrate. Suppose there is a universal healthcare, and what we have proposed is very simple. Everybody has a smartphone. Particularly India is full of youths. 65, 70% of the population is youth. Why not we give an education health cess on the mobile phone? So they pay maybe 100 rupees to 1,000 rupees to 5,000 rupees depending on their income as healthcare cess. That comes into a big pool. Why not we also tax a little bit more on cigarette and liquor? That comes to the same pool. Why not we also disengage from lot of PSUs and all and get that into same pool? And why not we even tax people who are not taxed, wealthy farmers, arcanut growers, coffee estate, a lot of them are not taxed in the past. So why not we tax a little bit more? Put all that into the one pool and create a huge a pool from which we can make sure that kind of insurance can be covered for all people of the society. I have done a calculation. In fact, I've published it. I've returned to the Harvard Business School also, where with this model, every patient, our average spending will go up to 300 rupees, $300. Phenomenal increase will happen with the low cost service we have. It can bridge the gap, and every individual can be taken care of with no limit as long as government properly monitors it.
That's a good plan. It seems to be a very good plan, Doctor. Hope it can be implemented in a right way.
But Sujatha, we have written several times, proposed. I even met few people, but I don't know where the where the problem is. I think it is so bureaucratic, and I think they feel they have a plan, but it's a failed plan. When the plan fails, people have to understand it's a failed plan and move on and look at other plan and learn from other nations also, how other nations have done. People like Brazil, take for example, amazing plan. Everybody is covered. In Brazil is also not an advanced country. I know it is an emerging market like India, but healthcare is superb, superb. Every individual is covered. Costa Rica, every individual is covered. How have these countries done? Of course, China may not be a democratic country, but every individual is covered. Okay, so we need to. This is not the right plan. The schemes like Ayushman and all, even though they're good intention, they actually do not take care of the issue, and sometimes they can make it worse. In our own analysis, 44% increased mortality, morbidity in the people who go under the scheme because it does not reimburse all the care. So in our tumor board, if you ask a doctor, why didn't you do trastuzumab? Why didn't you do this proper treatment? Says, doctor, the insurance doesn't cover. So I couldn't do. I saw a 24-year-old lady when we did the mortality to die because the insurance scheme, the scheme does not cover for certain things. It is catastrophic. It is really tragedy, and it is sad that people are not understanding this.
What's your opinion about the National Digital Health Mission? We are all talking about the digital and the smart hospitals, and then, what do you think?
Obviously, these are digital is a way forward according to some. The digital health mission is good, provided it can help us to make the primary care accessible and improve the primary care. So, in my view, the question is: you can have a digital mission. Will it really touch the rural women, the rural children? That is the key. That is the $1 million question. Will it touch? But in my view, I have mixed opinion. It may help certain sections, but I still feel the focus should be on more traditional way of managing primary health care. We have to look at, we have done one good thing is women, we have brought down human papilloma virus, at least in the southern India and western part of India, which is a great thing. With that, we are seeing less of cervix cancer, less of cervicitis and related problems. And still, head and neck cancer is very high. A lot of things in rural area, even in anemia in women are very high. So we need to focus on that. The digital mission, we are hoping, as we understand it more, how is it going to be rolled out, how you can really create records of people, how the records are transmissible, can be taken anywhere. These are very good. But I feel this is a little bit of a one step beyond us now. It is like if you phase on, phase 2, phase 3, we are still in phase 1. We need to build a solid infrastructure. We need to make sure access. Then we go to the phase 2, where digital records, digital things, so that we can manage the patients better. So I would say focus on the fundamentals, next 5 to 10 years, build it, and then go to digital in a big way, metaverse, digital. Then we have got the infrastructure to push there. So this is my personal view with some of the understanding I have. But as long as whatever whatever way we approach it, even digital healthcare, if it can help the lower socioeconomic group to access better healthcare, it is wonderful.
World Cancer Day. So I would like to take your quote on that.
I just want to say, in a cancer, 45 years of being an oncologist, having started at CG few decades ago and being one of the leaders in oncology globally, I think cancer care has remarkably changed. And now, fear was one of the worst problems with cancer. But today, cancer care has changed so much, it is becoming a chronic disease. So, my message is we should stop using certain terminologies where we use cancer for other things. Like when there is corruption in the society, we say cancer of society. We should stop using such words because it has a different connotation for the cancer patients and their families. Two, we should not use words like terminal care, palliative care, because we don't use such terms for diabetes or other chronic diseases. So we should now use proper terminology going forward for cancer and give proper information to the patient and communicate. With this approach, I think we have a good chance of winning the war over cancer.
Final question, your views on the budget.
Like I briefly mentioned, obviously budget had a lot of things, but as I feel overall, it was not a very impressive budget. It did talk about in healthcare, about health, mental health. It talked about a couple of other things on the health. And overall, it is not a huge differentiator, but I had hoped with COVID situation, importance to the health, there'll be more spending to the health. There are some reports saying there may be some little bit better allocation. Devil is in the details, as we know, but we need to look at it. But at a macro level, healthcare has not been given that great importance, in my view. But I think it's time we give more importance to it and help private enterprise, really come out of this crisis and move on to do the right care for the people. That kind of encouragement is needed. I hope in future they will see this need and encourage.
Thank you, Doctor. Thank you for the insightful conversation that we had. And thank you for your time.
Thank you.